Top story at 10. Idaho's coronavirus deaths now surpass 500. New cases continue to trend upward, with the state reporting 673 new probable and confirmed cases today. Federal health officials have been scrambling to develop a vaccine and now say that they hope to have up to 300 million doses by January. Our Madeline White looks at what that might mean for Idaho.
A coronavirus vaccine is yet to be licensed, but Governor Little has now revealed new insight as to who will be prioritized for that vaccine when it comes to Idaho.
Availability of a safe, effective COVID vaccine is one of the biggest hurdles to getting back to normal.
That's why Governor Little's established a COVID-19 vaccine advisory committee, and they've announced they'll submit a request by next week that raises Idaho's hand for a vaccine from the feds as soon as it becomes available. And when it becomes available, that committee says healthcare workers will get first priority.
We are going to be almost certainly targeting adults first, whether they're healthcare workers, seniors living in nursing homes, other essential workers. We're going to be focusing on encouraging adults to get vaccinated, offering it to those groups first. Again, initially in a very limited supply and then eventually a broader population.
But what about cost? HAHN says they're aiming to avoid patient charges.
The goal is that nobody will need to pay a cent for the vaccine. The federal government has purchased the vaccine. It'll be provided free, and doctors that offer those immunizations can bill insurance. For people who are uninsured, we are working on processes so that the doctors can be reimbursed through another mechanism, not by collecting money from the patient.
And then there's the question of how will officials urge people to get vaccinated, and will there be a mandate?
Our mandates for vaccinations in Idaho are pretty minimal, but we have to get to a certain level. And I would almost argue that not having a mandate will make it easier.
When asked why, he added,
I think people will sit down with their community, with their healthcare provider, with their families, and do the right thing.
Reporting in Boise, Madeline White, Idaho News 6.